Hello, everyone. Hey, hey. Happy Sunday. That's what it is. Happy Sunday. And I have say it's Sunday. Yeah. It is say it's Sunday. So I am welcoming you here today. I'm Angela McGowan, your professional healthcare advocate. And yeah, I'm doing more than one thing, so I'm sorry about that. Your professional healthcare advocate and your caregiver strategist. I am the author and publisher of this book. What you don't know could kill you. How to get out of the hospital alive. That's right. And I'm the founder of Angie's Pace. That's patient advocates committed to excellence. So happy Sunday. Welcome, welcome. I'm so glad that you are here. Welcome to the replay viewers. We are talking about something so important today, and that is about medication. We're going to be ending our series that we've been doing on Say It Sunday regarding medication. And I know it's at the end of the month, but next Sunday we will be concluding what we're doing all during the week. So I will tell you about that in just a few minutes. But first and foremost, I want to bring you what those two things, those two words, important. Thank you. Thank you, caregivers. Thank you so much for always, always, always putting the needs, the wants, the desires of others. Thank you for being so kind and gracious. Thank you for being so loving and so selfless that you are always, always doing 100 for someone else. And so we want to thank you. And if for some reason, I'm sure it was an accident, that no one did not say those two words for you today, hey, it's my honor to do that for you right now, to thank you, because you are, I always say it, and it is true. The caregiver is absolutely irreplaceable. So if you have an awesome caregiver, make sure that you thank them, make sure you appreciate them, because there is a rise in the need for caregivers, and in a few years they will be like almost like a store that we used to know about, because there's going to be so much of a need and not enough of them. So we want to thank them right now. I also want to let you know that inside of our title is my link tree that gives you all the information about me, about my books, about the results call. Everything you need is all in one link now. So I don't have to give you all those links, but we can just do one thing, and that's Linktree Pro Patient Advocate, just like on Facebook at Pro Patient Advocate. So let's get started with today, that we have thanked our caregivers properly. All right, so we're talking about being cautious, really, with over-the-counter medications, because we know that we already have medications from physicians. They've given you directions and instructions. I feel like maybe this is something. I think, okay. I just feel like I wasn't quite being able to feel it, but I feel better now. Okay, I hope you feel better. So, talking about those over-the-counter medication in conjunction with your prescription medications. Again, sometimes, not always, but sometimes this is in conjunction with many people practicing medicine without a license. They feel that they can, you know, counter and just, push the envelope to the end. So let's talk about that. All right, so over-the-counter medications are sold without a prescription, but that does not mean this. They are not risk-free. All of them have some type of risk, and it's back there on the back or sometimes on the side of the box. I invite you to read that before you take them, because there's some important information. Now, products that contain like antihistamines, like was it Alacor, Chlormetton, those kind of things, which are also you need for like a sleeping aid. You're using that, and then you go and get your Tylenol PM, and then you have your cold and your allergy brands that your Benadryl. All of these things mixed together cause not just confusion, causes blurred vision, it causes constipation. That's right, urination problems, dry mouth. All of this can be found in older people. So there's also a danger of overdosing. When you don't know those little side effects and the dosage of that, plus the dose of what you're already taking, and you listen, as you age, especially if you're not drinking enough water, your medication stays in your system longer. Therefore, you might think you've taken your medicine a few hours ago, and it's just like a few minutes because it's just that much inside of your body. So let's talk about something that's called the SAIDs, NSAIDs. That's what I said. Non-steroidal. That's what it's, non-steroids, anti-inflammatory drugs. Okay, so they're long-lasting and they're called NSAIDs, SAID, and then apostrophe S. Okay, so these anti-inflammatory medications, as you know, they're used to reduce pain, reduce inflammation, but in older adults, okay, there's a risk of indigestion, there's a risk of ulcers, bleeding from the stomach or the colon, all right? It can increase your blood pressure, affect your kidneys, and make worse if you are already in heart failure, okay? So because of this increased risk of bleeding, you know, with that and your other medication, like an aspirin, or also listen with what they call it warfarin or Coumadin, okay, which also is like your blood thinner. You have to be so careful when you're taking these over-the-counter medications. If you are 75 and older taking these, you need to always protect your stomach because there's higher risk of you having bleeding in the stomach area. The next thing we want to talk about is muscle relaxers. Be cautious about your muscle relaxers, okay? Because here's the concern, okay? Those medications will leave you feeling groggy and confused anyway, which gives you an increase in falls, right? Constipation again. Plus, there's little evidence that these things are working enough for you. The side effects of being knocked out sleep or, you know, that unbalanced feeling is what you are getting. So when you're taking Robaxin, Soma, Flexeril, be careful with those. Also, when you have anti-anxiety or anti-insomnia drugs, what are the biggest ones that we have for prescriptions? Valium, Xanax, Ambien, okay, those are usually the top three. So here's the concern with those drugs in conjunction with anything you would take over the counter, okay? Because these medications also increase risk of falling, cause confusion themselves, right? So it takes a long time to get these out of your body. So that groggy, sleepy feeling, you still feel like you're not getting enough sleep, and you add a sleeping aid to it, yeah. What they're saying is there's a great chance of you not waking up, and so we don't want that to happen. All right, you have your drugs for like antidepressants, okay? Anti-Parkinson's drugs as well, okay? And some of your irritable bowel syndrome drugs, okay? So when you have a overactive bladder, okay, and you take something like an antihistamine on top of like Benadryl and all these other things, or Tylenol PM, these things are just volatile when they're mixed together. There's nothing wrong with Tylenol PM. There's nothing wrong with Benadryl. But when you are taking certain specific drugs, you are asking for a big, big problem. Here it is. Very risky. Your heart medications, okay? If you're taking a dosage, well, I won't even talk about your heart medication. Just stick with it, because somebody might say, I don't take that much. But if you're taking a heart medicine, okay, and you are already taking something that's helping you with heart failure or irregular heartbeat, then you add any over-the-counter medications with it. Not only will it become maybe toxic with that, it also can mess with your kidneys. Now your kidney function is in jeopardy as well. So we don't want that to go on. Diabetes drugs, that glyburide is just one of the more popular ones, okay? Now, by itself, when you add something to it, it can make your blood sugar, you're trying to bring your blood sugar down, but it could drastically drop your blood sugar when you are taking another over-the-counter medication. And it's not specific, just the fact that there's another one. So that's why you need to always consult your physician. Now, the opioid pain relievers, we know, we hear a lot about them. Demerol is one of them that you might be taking. Any kind of opioid analgesics. those kind of medicines anyway can cause confusion, falls, seizures, hallucinogens. And when you add something to it, because they already are giving you those risks, right? So when you add something over the counter, you're sending your percentage of this occurring in a major way, like way up, okay? Then you have your antipsychotic drugs for depression, schizophrenia, bipolar diseases, okay? They're already coming to help you, and they have major side effects. All right. When you add over the counter, what you can do is have a risk of stroke or even death, okay? Cause tremors and even more risk of falls. So whatever medication you're taking as prescribed by your physician, take it as they ask you. But please don't go and just get something else because you feel a cold coming on or some kind of sinus. Just don't go and add that to it. You need to call and talk to your physician. Okay, you need to talk to them because they know what they prescribed. Another resource, of course, we'll talk about in a minute. Let me not get off. Is the last one is the estrogen. Be cautious of the estrogen pills, okay, and the patches, okay? They're prescribed, of course, for menopause, hot flashes, and all those kind of related symptoms. But estrogen can already, added estrogen in your body can already increase the breast cancer, blood clots, and even now they said dementia. So if you, and incontinence in women. So if you are taking it with already side effects and you adding the over-the-counter drugs, then you always nearly double the side effect or the risk of what would happen to you. So let me transition just right here about between the prescription drugs and what you're doing, okay? Because this is a fact. Healthcare is not a privilege. I always say that it's your absolute right. And guess what? It's your responsibility. So go and exercise your right to get great health care. Make sure you're going to your doctor. Make sure your doctor is answering your questions. Make sure you are leaving there with clarity. And then take your responsibilities seriously, especially when it comes to the medications. Okay? Whenever, every single time a doctor prescribes a new medication or makes a change in the dosage of what you're already taking, ask why. Why? Ask. It's your absolute right and it's your responsibility. Okay? Let your healthcare providers know about any past allergic reactions. Maybe something you've been taking, you've taken it for quite a while, everything's been going fine. Now you're having a reaction. Please don't keep taking that medication. Please call and let the doctor know. Please go in and see a lower dosage, another brand, another medication, but don't just skip over it because it's not that, intolerant. I mean, because you can tolerate it is what I'm trying to say. Okay, the next thing is do your best to have all your prescriptions filled at the same pharmacy. Now, I know if you have a specialty drug, it might have to come from a different pharmacy, but anything else that you have, try to have it at the same pharmacy because they have a running history and things come up on the computer as they add more prescriptions to your file. It sends a notice to the pharmacy and or the pharmacy tech. Okay? So that's why I'm not saying if you go to the same pharmacy, you go there on one, by your house, and then you go 20 miles away. Yes, they have the same system. I'm talking about total different providers that you are going to. You go to this one this week, and you got another prescription over there, and then you shopping over here, and you say, no, try to get them all together. And if you have them separated like that, please try to transfer them. All right, remember, your pharmacist is another one of your providers, so ask them. If you're feeling sometime when you get the medication here, they always ask, would you like to talk to a pharmacist? Would you like a consultation? And there are some medications you'll get where they say the pharmacist has to speak to you, okay? They have to speak to you. And that could be because of what is flashed up on your file. But if they ask you, and even if they don't ask you, it never hurts to talk to the pharmacist about the different medications you are taking currently. And here's something that I think is so, it's so important. And this is not something that is done often. Sometimes you can get a new medication for whatever it is you need it for. And then the side effects of the medication are so strong, okay? You go back to the doctor. The doctor may, and sometimes does, give you another medicine to fight the side effects. So you might have been taking 1 or 2 pills for whatever it is, and now a third pill is introduced. Or it could have been just 1 and 1, whatever it was, another pill. Stop and ask. Stop and ask. Stop and ask your doctor whether it makes sense to continue taking the drug that's causing this bad reaction. Is there something else? Why not ask? It's your right, and it is your responsibility to stop and ask. Okay? The 5th one. At least twice a year. Twice a year, okay? Stop and ask your doctor to review your medications and see if there's some you can get off of, the dosage can be lowered, or maybe it's something he's like, didn't I tell you to stop taking that? Okay, because that has happened. Yes, it does. All right, so I want you to be medically safe all the time in every arena, every part of your healthcare journey, from the doctor's office, inpatient, skilled nursing, at-home care, what you get from your pharmacy. And so that's why we're here. So again, thank you for joining me. I'm Angela McGowan, your professional healthcare advocate, your caregiver strategist, author and publisher, and I remember that I help you navigate through healthcare's sea of red tape. And I create strategies that will allow you to give excellent care to those that you love and care for as you care for yourself. And I want to invite you to join me on next week, starting tomorrow at 9:05, Monday through Friday. And I'll be talking about minority mental health awareness, which is this entire month, but we've had quite a few other things already pre-scheduled, but it is so important. So join me at Angie's Pace or at Pro Patient Advocate. I look forward to seeing you. And we will end Minority Health Awareness Month on next Sunday. So that's why we're stopping our medications, moving on to Minority Health Month. Okay, thank you for joining me. I leave you with what? Those 2 things. Blessings and joy. Why is that? Because they both belong to you. Have a happy Sunday. Thanks for joining me on Say It Sunday. Everybody be blessed. Talk to you again on tomorrow. Bye.